I had the best conversation this morning with one of my favorite patients. She's a 60-year-old grandmother, and basically she's so excited because she's going to get to see her grandbabies after many months of not seeing them. And basically with these new guidelines that were released yesterday by the CDC, if you've been vaccinated, like my patient, she did the right thing, and 2 weeks have passed since her second vaccine of the Moderna, she's now considered vaccinated fully with the full effect of the vaccine. So with these new guidelines, she can now see her grandbabies because even though they haven't been vaccinated, you can congregate with someone from one household, basically, and you don't have to wear masks. So she says she's going to give them a kiss. And the guidelines also stated that if you've been vaccinated and another person has been vaccinated, you can gather together in one household and basically not wear masks. And because of this, my wife and I, who've been vaccinated, we're going to meet with my college professor from Belhaven and his wife, and we're going to have a dinner, and we're going to just smile and have a great time. It's going to be healthy. But also, the guidelines stated that if you've been vaccinated and you're exposed to someone with coronavirus, you don't have to separate yourself from others for 10 to 14 days as you did before, but now you can carry on unless you develop symptoms or if you live in a group setting like a detention center or a group home. So these are some very encouraging new guidelines, and everybody is just so excited, especially my patient that's going to see those grandbabies.
Dr. Quinn, you're talking about being fully vaccinated after the second dose. How much will this make a difference with the Johnson & Johnson one-dose vaccine? How will these guidelines play? Is it still 2 weeks after that one-dose vaccine that you can do some of the same things with Pfizer and Moderna?
That is correct. And that's really encouraging because a lot of people were questioning, which one should I get? What I like about the Johnson & Johnson is it's only one vaccination dose. So once you get it, you let that 2-week window go by and you are considered vaccinated. You have the protection of that vaccine. Now, if you get the Moderna, you have to wait 4 weeks, and then you have to wait an additional 2 weeks. And if you get the Pfizer, you wait 3 weeks, an additional 2 weeks. So if you want to go see your grandbabies, hey, I don't know, the Johnson & Johnson is looking pretty good right now.
Well, it depends on where they want to borrow money from me, I would think. I don't know. Hey, in addition to these new guidelines, though, we're also hearing, Dr. Quinn, something about what's called a vaccine passport, which proves that a person has had, the 2 doses of the vaccine or the 1 dose of the Johnson & Johnson. This passport would allow people to, like, fly on airplanes and things like that. Is this where the future is headed, do you think?
Well, there have been a lot of healthcare analysts that have been making predictions. I did a show a while back about this, and it's a lot about protecting the community. And there's going to be a lot of uproar. But basically, if you own a business and you want to look out for the safety of your business, say you own a restaurant and you want people to come in, well, there's a legal debate where you can require people to show proof of vaccination to enter that business. And if you haven't been vaccinated, then you can be denied service. So that's something that's going to be on the uprise, and we're going to just keep an eye on it. But just remember, it's for the safety of everybody, not just yourself, but safety of others. And as long as we keep that in mind, I think that this will progress in a positive way.
Hey, well, thank you, Dr. Quinn. I appreciate you joining us this afternoon. And have fun at your dinner.
Thank you so much. You too.